My name is Helen Voronina. I'm an implant dentist from Paran, Melbourne. Today I want to show you how to care for your All-in-4 and other implant systems. I'm going to demonstrate using this little model that I have here. So the first thing you need to do is to give your bridge a bit of a brush. This isn't the most important part of the process, but just removes any plaque and tartar that might be building up and staining. So just give it a good brush, your teeth and your gums, on the outside and the inside. I'm showing you very quickly, but spend a little bit of time doing this. It's best to use a soft toothbrush, and believe it or not, soap is better than toothpaste. Toothpaste is a tad too abrasive for acrylic, so it's best to use something softer, which is just simple hand soap. The second part is the crucial part, and that involves you cleaning around the implants underneath the bridge. You will need a special device for this that's called X-Lite Floss from Idontics. It has a nylon loop and floss attached to it. The nylon loop makes it easier to pass it under the bridge, so I'll show you here. You simply thread it through under the bridge. You grab it on the inside and you pull the floss through. Then you wrap the floss around the implant, and in back and forth motion, you just rub it against the implant several times. I'm sorry, this model is a little bit tight, so I'm struggling to show you, but in the mouth it's usually a lot easier. You want to wrap it around the implant, keeping in mind that the implant is a cylinder. So you want to clean half of that implant. Then you pull the floss back out and you thread it around the back of the same implant. Okay, so once again you want to wrap it around the cylindrical implant and move it back and forth. Once again, this model is a little bit tight, so it's hard for me to show, but in the mouth it's usually pretty straightforward. And you do this several times. And you repeat this process with all your implants. So this model has 4 implants, so you would put it in through here, clean the front of the implant and from the back as well. And you do exactly the same with the other 4 implants. This needs to be done once a day. I can't emphasize enough how important it is to look after your implants. They can serve you a long time as long as you don't develop infections around them. And the best way to prevent that is to floss them daily and brush them daily. But it's also important every 6 months to get them reviewed and professionally cleaned. The dentist will typically remove the bridge for this process and then reattach it back to your implants once the scale and clean is done.